I am Zainab M. I would like to present my case regarding to the extra oral examination. She is 12 years old, female patient. There was no relevant medical history. Regarding to the frontal examination at wrist, she has ovoid facial form with asymmetrical face. She has a slight deviation of the chin to the right side with competent lips. Transverse fifth within the normal with slightly decrease in the left outer fifth and slightly narrow mouth relative to the interpupillary distance. Regarding to the frontal examination at smile, smile arc defined as relationship of the curvature of the incisal edge of the maxillary incisor and canine to the curvature of the lower lips. The ideal smile arc is maxillary incisal edge curvature parallel to the curvature of the lower lips upon the smile. In my case, coincident smile arc. The arc of the upper teeth follow the lower lips. And regarding to the maxillary midline, we can see shifted to the right side with asymmetrical gingival display. Regarding to the soft tissue profile analysis, angle of convexity, she has normal facial convexity with obtuse nasolabial angle. And regarding to the vertical facial proportion, she has decrease in the lower facial height and the length of the upper lips is less by third to the total lower third of the face. Maxillomandibular prognathism, we can measure it by horizontal line parallel to the floor, trooped by line from the glabella. The normal value, the distance from the subnasal to the vertical line should be 6 plus minus 3 mm, and from the bogonian should be on or close to this line, 0 plus or minus 4 mm. We can see here retrognatic maxilla and mandible. Assessment of the nose. Nasofacial angle, we can measure it by line from the bogonian to the glabella. Nasofacial angle, we can measure it by draw the line from the glabella to the bogonian with line along the axis of the radix. The normal value is from 30 to 35 degrees. We can see here nasofacial angle decrease by 5 degrees from the normal value. Nasomental angle, we can measure it by draw the line along the axis of the radix with E line. The normal range is from 120 to 132. We can see here obtuse nasomental angle. Mentocervical angle, it's within the normal and we can measure it by A line and submental tangent. Submental neck angle, it's also within the normal. We can measure it by submental tangent and neck tangent. Lip position in relation to the E line. E line, we can measure it by draw the line from the pronasal to the bogonian. In the normal value, the upper lip should be 4 mm behind this line and the lower lip should be about 2 mm behind it. In my case, she has retrusive upper and lower lips. Burston line, we can measure it by draw the line from the subnasal to the bogonian. In the normal value, the most prominent point of the upper lip should be 3 plus or minus 1 anterior to this line, and the most prominent point of the lower lips should be 2 plus or minus 1 mm anterior to this line. We can see here she has retrusive upper and lower lips. This line we can measure it or we can define by draw the line from the bucconium to the midpoint 5 shaped between the pronasal and subnasal. In my case, she has upper and lower lips, two flat upper and lower lips, because it's laying behind this line. Merrifield Z line, it is within the normal range. Interlabial gap, it's the vertical distance between the upper and lower lips, and it is within the normal range. Problem list, we found in the anterior posterior dimension retrognatic maxilla and mandible regarding to the skeletal problem, and obtuse nasolabial angle and nasomental angle with decrease in the nasofacial angle and retrusive in the upper and lower lip regarding to the soft tissue problem. And in the vertical dimension we found asymmetrical gingival display of the right and left side of the canine regarding to the dental problem, and slight decrease in the lower facial height regarding to the soft tissue problem. In the transverse dimension we see asymmetrical right and left outer fifth regarding to the skeletal problem, and midline shifted to the right side related to the dental problem, and slightly narrow mouth relative to the interpapillary distance regarding to the soft tissue